I'm Jennifer Sanasi. You're watching News 24 Live. Our resident doctor, Dr. Darren Green, is joining me in studio, and he is answering your social media questions. Hello.
Good day.
Now, social media questions. This one is interesting to me because I actually just had a throat infection.
Right.
This News 24 user wants to know, how can throat infections be treated, and how dangerous could it be to have one?
Well, it depends what's causing it first. Everyone knows about a cold or flu that can lead to a throat infection. In other words, you have a bit of the slimy Snotsicta, as we know it, and a little bit of mucus that trickles down the back of the throat, draining from the sinuses. Everyone refers to that as a post-nasal drip, the back of the nose, and it drips down. Now, if you have that constantly, you can imagine that the mucus or the secretions often gather and get stuck at the back of the throat.
Right.
Acting as the perfect breeding ground for some bugs that are just waiting to actually multiply and really move in and actually accommodate that area. So what happens when you have things like the tonsils and the adenoids, and the back mucosa or the skin of the throat becomes red and inflamed as people obviously increase the load of organisms at the back of the throat and keep swallowing and coughing, etc. When we look at the throat with the light, you can see it's red, inflamed, the blood vessels are quite dilated, and sometimes you can even see wiring, in other words, the yellow strands of mucus as they're trickling down the back of the throat. Now, normally it starts off with a cold or flu or on the basis of allergy, so people can develop a post-nasal drip due to allergic rhinitis. In other words, a trigger in the community, in the environment, or in food can cause your nose to start running and running and running. And eventually it could lead to congestion and a blocked nose and sinusitis, etc. The throat itself can, however, be affected with recurrent reflux disease, and that's what many people don't know. So the people that get recurrent throat infections need to go and have a look. Is there a problem with the drainage of the sinuses in terms of the mucus at the back of the throat? Or is there a problem with reflux disease where the content of the stomach, for example, when you sleep at night, rolls back up all the way to the back of the throat, and that you can imagine the acidic pH damages and actually harms that skin right at the back of the throat and leads to complications. And then obviously it trickles down when you come back into the upright position. So often when you have recurrent infections, people forget to treat for reflux disease. Is it dangerous? Yes, it is, because if you don't treat a throat infection that's bacterial, for example, the same organism can get into the bloodstream and travel to a typical organ like the kidneys. And one of the big throat organisms is Streptococcus. And Streptococcus can certainly cause significant damage in the kidneys. It's called post-streptococcal glomerulonephritis.
That sounds scary.
It's like a mouthful of a really exotic dish.
Sounds like it should be on Harry Potter.
But you can imagine that you need to protect yourself from bacteria spreading to the organ systems, leading to damage and in some cases permanent scarring of the kidneys.
So I think a lot of people are watching and they think when I have a cold or a flu, you can wait a few days and it's going to go away on its own. When should you go to the doctor for a throat infection?
Good question. And I think fever should guide you. Often you have a low-grade fever of about 38 degrees, maybe once a day or twice a day, with no associated, sweating episodes and joint pain, muscle pain, etc. When that fever, however, becomes so frequent that it causes great discomfort, when it's associated with 3-hourly bouts, for example, associated with headaches, etc., one would certainly want to have a blood test done to help ascertain is it a viral or bacterial infection. You can't just distribute or prescribe antibiotics without knowing whether you're going to be effective or not with your treatment. So one should certainly advise, treat the fever for 24 hours. See if the frequency of the fever gets better in that time. Gargle with basic salt water, for example, if you don't have a mouthwash. And then also consider treating pain, because pain can be treated with simple paracetamol for the first 24 to 48 hours. And then if the frequency increases, seek medical help and have someone examine the throat. Let's not forget, it's not just infection that gives you a sore throat. There are other things as well, things like oral cancers and throat cancers. Growths and polyps in the ear, nose and throat area are important not to miss, and early diagnosis could save a life.